guys, welcome to video blog number 2. So my intention is to try and do these after doctor's appointments and after treatments, so you guys will be able to follow along as I go through this process. So today I saw my primary care physician, who's been taking care of me for nearly a decade. He doesn't like it when I say it that way, it makes him feel old, you know. Anyway, we went over where my care is at and the fact that the CPRS has spread into my right side. And the hope is that with the treatment that we're going to start, we're going to be able to reverse that. So I have hope. But we talked about what's happened with my breathing and with my ability to get around. And we're hoping that we'll be able to see that change with treatment. But I was told that the medications that are required for me to take and the fact of what's wrong with me all come together to play a role in why I'm having problems with my breathing and why I have to use the oxygen sometimes or the inhaler, or why sometimes you'll hear my voice change. And it's in part by the medications that I'm on. It's in part because of the tram flap and the pressure that it puts on my left lower lobe of my lung, my diaphragm, my stomach, my intestines, my bladder, which causes for some humor on occasion and other times, you know. It's all on how you look at it. You can't, sometimes you have to chalk something up as to, I'm not going to get embarrassed, I'm just going to laugh it off. And that's okay. As long as you're surrounding yourself with really good support and really good people. And trust me, that is key. That's been huge in my care. And part of how I utilize different methods to deal with my pain. You're going to have people telling you everything under the sun. You have got to follow your medical provider's advice and what's best for you. For some patients, that means being on a medication they don't want to be on. And I understand that. I personally can't take opioids and narcotics because of what's wrong with me. It's not recommended. There's a chance that it could cause my breathing issue to become more, let's just say my body could kind of maybe forget how to breathe. So it's better to just not have me on those right now. Does that mean that there won't come a day that I'll have to accept them? I can't say that, but I'm not going to worry about it either. What we got to worry about is the here and now, this moment. So in this moment, we are making a med change. We only do one med change with me at a time. That way we ensure that my body handles it okay. And if it doesn't, we know the medication that's causing the problem and we're able to remove it from my system so we don't have a problem. So I am very blessed and very lucky that I have so much love in my life. And Matt and Kristen, and I am, I guess you say, dream come true life in some regards. So don't feel bad. You know, if it had to happen to somebody, I'm glad it happened to somebody like me who has a big mouth and is willing to get out there and talk, or yell and scream, or pound on a door, or whatever it takes to help get us better care. Hopefully the American Medical Association's recent release of a proposal to help doctors to separate out the opioid hysteria and what's going on with the crisis there from patients who have chronic and severe conditions like post-mastectomy pain syndrome, complex regional pain syndrome, reflex sympathetic dystrophy, cancers, lots of things that unfortunately don't come with a cure. And until we have a cure, we need to be able to treat people in a way that they can still have a life of dignity and quality. And that's what I'm hoping to achieve and continue in my battle to keep my pain under control and to try and stay off the progression of this thing. So stick with me if you want. I'm going to take you on this journey. We're probably going to be taking a break now with the holiday coming up. And treatments will begin in a couple of weeks, and in between that I will be meeting with the geneticist, and I will talk to you about the genetic aspects of what's wrong with me and why it's important in some cases for some people to have genetic testing or see a genetics doctor for assistance in what's wrong with your body. Or basically to try and help you prevent what could go wrong because of your genes. Just because you were born with it doesn't mean we can't treat it. Medical science is growing every day. Let's keep up with it. Let's keep up with the information. Keep sharing it with everybody that we can. Every share is one more patient who hears that they're not alone, that there is really help out there, and that they don't have to suffer. So I wish you all a great Gobble Gobble Turkey Day this November 2018, and I hope to see you guys soon, or see you online. Feel free to follow me on Facebook or on Twitter, or you can check out IPMNation.com, which is our international radio and TV station, for lots and lots of great shows and lots of great people to either take your mind off of what's going on or help you fill your mind with new information. So you guys take care. Bye now.